Today marks World Cancer Day. This day is observed annually on the 4th of February to raise awareness of cancer and to encourage its prevention, detection and treatment. So according to Cancer Foundation research conducted back in 2020, South Africa ranked third highest for new cases at close to 110,000 and in the top three for deaths at over 56,000. To take this discussion further, we are joined by teams by Professor Riana Bornman from the Department of Urology at the Faculty of Health Sciences at the University of Pretoria to explore further. Prof Riana, if you can. All right, I believe we're going to reestablish that connection and continue. All right, I believe she's back. Prof Riana, if you can hear me, good afternoon, and thank you for your time with us here on the SABC at this hour.
Good afternoon. Thank you very much.
Just for context's sake, perhaps you could speak to the different forms of cancer most prevalent in South Africa and, you know, what that picture looks like on the ground.
I think the concern is really in South Africa about cancers like colorectal cancer, rectum cancer, breast cancer, prostate cancer, and then the blood diseases like the leukemias. And I think for that reason, we can focus on these cancers for cancer awareness.
What is your opinion about the current service delivery models and its efficacy given the needs of our time as we're speaking?
I think there is inequity in terms of cancer awareness, cancer care in South Africa, and for that matter in Africa. I think we really need to have equity in terms of cancer awareness. The people in the rural areas are likewise going to develop cancer, and they are at a disadvantage, which means that we need to create awareness in them for better care, taking care for themselves.
Prof Riana, because I want to then look at the strategies for achieving universal health care. And I wonder if enough is being done at this point regarding policy and with regards to NHI in terms of access and mitigating against those inequalities that you speak of, even just reaching, you know, the SDG goals for both public and private.
I think there is general awareness in in the private sector, but it's not the case in the rural areas. I've been working in Limpopo in the rural areas for the last 20 years, and it often strikes me how little people are aware of the cancers that people in the cities so-called develop, as if they are not exposed to the likelihood of getting those cancers. So I think we need to be very vigilant about people in rural areas for creating awareness, because there are a lot of people with a lot of cancers, and they do not have the care that we are fortunate to have in private practice as well as in the urban areas.
Because you speak about awareness, you speak about access, there's even the question of affordability. And what are some of those barriers to entry regarding diagnosis, oncology treatment, and even just the inequities that come from the treatment and affordability itself?
I think it really starts by this big divide between awareness in the city and in the rural area. People are not aware, and if they are not aware, it means that they do not have a high index of suspicion if something abnormal happens. If one can create awareness in the rural areas to be similar to in the urban areas, it will make a difference. Because if the moment you start teaching people about being aware of their bodies, of what is normal, what is abnormal, they can be more vigilant about creating awareness and responding when they realize that there is something wrong, and therefore present at an earlier stage. We've seen it with prostate cancer so often. We do not get the men to present early enough to do intervention and prolong life. They present at the late stage, and therefore we cannot do curative treatment for the men of prostate cancer, many of them. And I think that's sort of unfair. If we cannot create awareness, it means that people will present late with cancers.
Now I want to look at the role of stress, lifestyle choices, and even behavior, and how that plays a role, coupled with advances that had been made in diagnosing and treatments available as well to reduce some of those risk factors. What are you observing on that front in a South African context?
I think there are some known risk factors and there are unknown risk factors. I think if we know what the risk factors is, we have to start educating our public to understand the risk factors and therefore respond with early awareness. I don't think we do enough, especially not in the rural areas where one often needs material in the local language, and taking time to sit with people in their circumstances to be able to create awareness. I think that's one of the only ways to create awareness. You cannot have a meeting like we do in the city and expect people to turn up there. If you want to create awareness in the rural areas, you have to go to a central meeting where they are meeting, ask permission, and then start with your awareness discussions at that meeting.